Welcome to the Freedom and Prosperity Podcast with your host, Desi Arnaz. Join us as we explore the journeys of top achievers who share strategies and stories about their success and living life on their own terms. Get ready to be inspired.
Well, hello and welcome back, guys. I am Desi Arnaz, the host of the Freedom and Prosperity Podcast, and I want to thank you guys for joining me again today for today's episode. I am really excited. I'm going to be talking with a fellow San Diegan here. His name is Bill Hammett, and we're going to be talking about Bill's story. And I think you guys are going to find his story enlightening. Hopefully, it's encouraging and inspiring for you. That's what I'm hoping that you'll get out of this. Bill's a very good guy. He is the president and founder, I guess is the word I could use, of Hammett Health Insurance Services. That you guys provide health insurance service. Well, you know what? You mentioned something, Bill. You said that you have healthcare literacy. And to me, that was a new term. I hadn't heard that term. So can we start there where you can give me a little bit of a definition of what you mean by healthcare literacy?
Yeah, I mean, our office, we have since 2007 worked with employers of all sizes to bring them medical, dental, vision, life, disability insurance products as a broker. We're independent. We represent all the major names. And through the course of all these years, we're just seeing so many employees not quite understanding their benefits, making poor choices as a result of it. We've tried many different things with open enrollment meetings and different resources to help. And here in 2025, we just made the decision to completely double down because the fact is 77% of Americans can't correctly define what a deductible is, what coinsurance is. People who have low healthcare literacy are 4 times more likely to have poor health and be hospitalized more. And so we felt like since we can't really control the rates and the benefits, these are set at a very high level and there's state regulations, we felt there was one way we could impact the lives of both employers and employees by helping them understand what they're buying, helping them understand the terminology, walking them through the process, and then providing them the resources that they need when it inevitably goes wrong because of the healthcare system is so difficult to navigate.
Boy, is it ever. It is difficult to navigate. And then insurances in general are complex. You know what I mean? The contracts.
Absolutely.
Just understanding what you get and what's covered and what's not covered. So that's what you mean by healthcare literacy.
Yeah, and there's an old saying that says, with insurance contracts, the big print giveth, the fine print taketh away.
And you're in the business, so you know it.
Oh, yeah.
Oh, boy. How long have you been in this space?
Man, you know what? I like to say I grew up in it. My mom and dad were both insurance professionals. I knew what the acronym COBRA meant when I was 15 years old. I always knew I'd be in the insurance business. Yeah. Started in 2002 with Blue Shield of California in the San Diego sales office. Moved on to my dad's insurance agency for a couple of years, and then just wanted to break out on my own and do it on my own. So in 2007, with the help of some great people, we were able to start Hammett Health and begin serving the employers of California.
Yeah. So that's one step towards that freedom you're looking for, right?
That's right.
Freedom and prosperity. That's what this podcast is about. Now, you're a San Diegan, right? Yeah. Were you born and raised here?
Born and raised in San Diego, up in the Carlsbad area. Okay. I ended up moving around, going to Pennsylvania for the last part of high school, 1 year in Ohio for college, and then back. So all but 4 years of my life in San Diego.
Okay. Well, I noticed that you have an affiliation also with SDSU.
That's right. The Aztecs. I'm a former football player for San Diego State, played for Ted Toner in the late 90s, early 2000s. Okay. And I'm still very, very much involved with the program. Was at an event last night with a lot of the people from San Diego State, the head coach Sean Lewis and athletic director JD Wicker. So we were supporting San Diego State, which I like to do as much as possible.
Yeah, that's beautiful. Those kids need some support, and some help. I saw too that you're a part of the Aztec Link, right?
Yeah.
And I like what it says there on your LinkedIn page. It says you're trying to connect fans with brands. Is that right?
That's right. Yeah. And NIL is a new space, and for those that aren't familiar, name, image, and likeness. This is the federal law that passed in, I believe, 2021 that allows for student athletes to be paid for their name, image, and likeness. So now these young men and women at these schools are able to make a couple of the dollars of the billions that are being passed around through all these events. Some of these guys are making some money, and a lot of the headlines are with the guys making seven figures and all that. But the truth is, there's a lot of young men and women that are making, $500 at a time, $1,000 at a time. They're able to help out mom and dad back home, help themselves out to a better meal, not have to go to fast food. So it is improving the lives of student athletes across the country.
Man, that's a great thing. I didn't even know that had become a thing.
Oh man, it is a thing, brother. It is a major thing, and it is the first thing that anybody that talks about around college athletics. So it's some people do not like it at all, and I think most people don't like what it's done to college football, or college sports in general, basketball and football specifically. But you know what? It's here to stay, man. It doesn't matter if you like it, love it, or hate it. It is.
Yeah. Well, these athletes, they're wonderful athletes, and they are, as you said, generating a ton of cash, and they get none of the financial benefit. I think it makes sense that they have at least an opportunity to participate in that. And so that's what you guys do with the Aztec Link.
Correct.
That's a nice thing.
It is good. It's great to meet, people in San Diego. There's a lot of businesses, a lot of people in this community that love San Diego State. I believe the number is 60% of the living alumni from San Diego State live in the county of San Diego. So it is really nice to be able to connect some of those brands with the athletes, and there's some big name brands such as Blenders with the sunglasses. They've done Chase over at Blenders has done amazing stuff for these athletes, both basketball and football players, and lots of other companies have gotten involved as well.
That's fantastic. That's fantastic. And you said you played football. Do you have kids?
I do have kids. That is who I am as a man on this earth, as a father. I've got two daughters, ages 14 and 12. I have a stepdaughter as well, who's 17, who's preparing to go to college. So we are in the thick of it, man. We are in the thick of it. Sports like crazy. We're playing volleyball and basketball right now.
Yeah.
But I love it because one day I'm not gonna be invited to these Catholic League, basketball games. There'll be no more PTA meetings, so I'm just trying to drink it all in.
Yeah. I feel sorry for the guys that don't quite get that, right? You seem to really get it, that these days are short, but they are precious. And boy, like you, I did all that I could to make it to those special events and anything that I could having to do with my four kids, whatever was going on.
Exactly.
It's paid off. I have a pretty good relationship with all of my kids, their kids, because I have grandkids too now. So
lucky you. That's the best job in the world, I hear, is grandparent.
You'll get there. You got three girls. So,
that's right.
You'll certainly get there.
That's
I have two and two, but being a grandparent has been a blessing, a major blessing. One of the things that I did, my wife and I did about 3.5 years ago, we started a family trust, right? And we put we made all of our kids and grandkids beneficiaries of the family trust, which is nice, I mean, I didn't grow up in, I don't want a bunch of spoiled trust fund babies. And so we put some restrictions in there, but we did some things, and we used insurance, by the way, to help subsidize, to help grow our wealth, right? Life insurance. I don't know if you sell life insurance. Do you sell life
I do, yeah. I mean, there's kind of two paths with life insurance, right? There's the real I want to protect my family against financial ruin in the case of my untimely death, and that's it. That's a term life type of policy, right? Really basic, low monthly annual costs. Protect your family in case the breadwinner or anybody in the family were to pass away unexpectedly. And there's kind of the other path, what you're talking about, which is financial mechanisms, which is investment vehicles tied to life insurance. I don't get into that. I leave that to the smart people. I'm just a dumb ex-jock that knows how to sell the basic stuff. But whenever someone talks about life insurance, I'm like, all right, tell me where you're at. Are you here where you just want to protect this
Yeah.
low price, or do you want to use this as a financial tool to do other things? And if it's a financial tool to do other things, that's where we go other places. But for
Sure.
friends that just want to protect their wife and pay for the house and college in case they pass, or for business owners that need key man life insurance or buy sell agreements funded by some basic policies like term life, that's the kind of life insurance I do.
Yeah. Well, I think we need them both,
Sure.
in my opinion. You know what I
Yeah, for
mean?
sure.
I've got I've got the investment part of it in our portfolio, but also, like you said, I also have just some basic insurance, not term, but
Sure.
basic insurance is not a part of that overall long-term plan,
Great. Yeah.
multi-generational plan.
Yeah. Yeah.
Yeah. So, and those insurance contracts are complex too. It seems like insurance is just complex.
It really is. And ultimately, it kind of needs to be. Maybe it's too complicated, but we are talking about, especially in terms of a health insurance contract, unlimited, payouts, right? These are multi-million-dollar contracts potentially, right?
Yeah.
You have a premature baby in the NICU, that's $1 million. You have long-term health issues with cancer or with long-term hospital stays. These are seven-figure expenses. And there's people, trying to abuse the system left and right. And so for
Yeah.
those reasons, we do need the protections, but you got to think that there's a way to make this easier on the consumer. It's just too bloated. There's too many different rules, and it really inhibits people accessing the care they need because they throw their hands up and they say, I don't know. And that's where our office can come in and is be that advocate, be
Yeah.
that person that can step in and say, and hold these insurance companies accountable, because ultimately what we sell is nothing more than a promise to pay. There's a cute ID card and there's all these summary of benefits and stuff like that, but it all boils down to a promise to pay. And when our clients feel like that promise is broken, we get off on jumping in and going through the 130 pages of the fine print and calling these Fortune 100 companies on their stuff and saying, no, it says right here on page 136 that you pay in this event.
Wow.
And so
You actually do that, huh?
Oh, for sure, yeah. The Control F button on PDFs is very helpful to be able to quickly find things. but it is a different language. This insurance language is a little different, and if you're a plumber or a salesperson or whatever it may be, you don't speak the language. We do, and everybody on our staff understands. And when I hire anybody, it's incumbent upon us to utilize this knowledge to better people's lives.
Well, Bill, I have to tell you, I've purchased insurance all my life, pretty much, all my adult life, right? I've never really heard another person say what you just said, and that is how you don't just sell a policy and we never hear from you or see you again.
Yeah, no.
Sounds to me like you're there like an advisor. You know what I mean?
Absolutely. Yeah. I mean, that is what we ultimately are with a lot of my clients. They call me for things that are outside of what we do, just because they know they can count on me for, if I don't know, you know what I say? I don't know, but I'll find the answer.
Yes.
I always say I don't have every answer, but I know where to find every answer, and so
Yeah.
And so being a trusted advisor is what, those of us in the insurance space want to be, because these are long-term relationships. We're not churning through stuff here. We have clients that we've had for 20 years,
Wow.
So that's important to do right by them because they're counting on us for that.
Well, as a second generation insurance guy, second or third? You're second, right?
Second generation, yeah.
Second generation insurance guy, you learned something obviously from your parents as well. So that's really good. And I like that. And I'll just tell you right here on air, I want to talk with you because I'm looking at doing something for one of my companies.
Oh, great. Yeah.
So
we'd love to help. Yeah. It's a complicated process, but our tagline with Hammett Health is insurance simplified. I grew up in this business. I understand it like better than I understand anything else. And I really love trying to make the complicated simple. And you do that by breaking it into many steps, understanding what are you trying to accomplish? Some employers are trying to comply with Obamacare. Okay, fine. That's a different strategy than an employer who's got a more paternalistic view of the insurance product and views it as part of the compensation package and wants to make sure that the health of their employees is taken care of, because healthier employees are happier employees are more productive. So it is a good thing for everybody involved.
Yeah, no, I like it. I like the way you think, just in general.
Thank you.
I can tell by some of the things that you said before we started the podcast and during this podcast that our minds are very much in alignment on a lot of things.
Yeah.
Yeah. So, besides insurance, what else? What's your story?
Yeah, I mean, my story is one of I've been a lot of places. I never was at one school from kindergarten through college more than 3 years. So there's a lot of moving around inside San Diego, from a private school to a public school, from public school to different high school, and then with divorce and with families moving around, I wound up back in Pittsburgh, Pennsylvania. Going into my 10th grade year of high school, which for a young boy, a young 14, 15-year-old boy, that might be the worst time to change schools. And I was going to a place where, nobody was new there. I was the only new kid in that high school for the entirety of the time I was there. Luckily, I could catch touchdowns. That made things a little easier for me in my social life. But then after high school, had lots of different offers to play college football in many different places.
Oh, wow.
Decided to go to the University of Akron. I never really viewed myself as an NFL type of player. I thought I was a really good high school player. I thought I could have a fun time and a good experience in college. And so wanted to go to the University of Akron, fell in love with the coaching staff there. Immediately got hurt. Coaching changes, things changed completely about my situation there, and so I made the very tough decision to leave some great people at the University of Akron that I still am in contact with. Left there and came back to San Diego. Played junior college football, and in the first quarter, the second catch, I was a receiver. The second catch of the first quarter, tore my MCL, and laying there on the ground thinking, why did I leave? I left a Division I scholarship. Now what am I going to do? Ended up having a great career at Grossmont College and had a lot of different opportunities at different schools, different places. The only place I wanted to go was San Diego State. My dad played for Don Coryell at San Diego State, so I didn't want to leave again. What's funny is I had offers from most everybody in San Diego State's conference. Lots of schools. I had a really good career at Grossmont, and the Union Tribune came out to do an article on me, and they said, where do you want to go? I said, it's funny, where I really want to go is the only place I haven't been offered, and it's the hometown team, San Diego State. Well, that was the headline, and by 8 a.m. that morning, head coach Ted Toner was on the phone with me, inviting me to come in. By 9 a.m. I had a scholarship offer. So,
oh my goodness.
And then I told him, guess what? I told him, I said, I have to think about it. He must have been like, this kid blows me up in the paper and then's got to think about it. Oh, really? So then I went there and loved San Diego State and still love San Diego State.
Yeah. San Diego State's a great school. My partner, Patrick Franz, his dad was athletics director over there. His name was Ed Franz. I don't know if you ever...
I did not know him. No,
he passed on now, and he was probably before your time. That he was doing that.
Sure.
But he loves the school as well, and Patrick spent a lot of time there, and attended there a little bit too. I don't think he graduated from there though. Mm-hmm. But yeah, it's a good. I don't know the school that well. I didn't go to college here in San Diego at all. I went in Illinois. I was raised in Chicago. I didn't move to San Diego until I was almost 40, Okay. Yeah. And so.
Well, welcome. Well, if you did go to San Diego State like I did in the late 90s and early 2000s, and you go back there today, it doesn't even look like the same school.
No kidding.
So these universities, UC San Diego and San Diego State, I think are two of the biggest developers in the entire state of California. So lots of projects there, including the brand new Snapdragon Stadium, which opened, and I was lucky enough to be invited to be a part of the ballot measure, Measure G, that got SDSU West approved. So I was a part of that. I love politics and policy. Well, I don't love politics as much, but I love policy.
Sure.
And I love that whole environment. Spent a lot of time. I was the president of the Insurance Association in San Diego when the Affordable Care Act came into place. and spent about 10 years going to DC and Sacramento and meeting with our elected officials to try to usher forward what we knew was going to be healthcare reform. But how do we do this in a way that is business friendly, that does accomplish the goals of getting people insured and lowering the prices? And I'm not sure how much we were successful in all of those lobbying efforts, but it's fascinating. Yeah. The political system is fascinating.
Yeah, it's difficult to influence these politicians. You know what I mean? It's difficult. Or maybe it's just expensive. I don't know which it is.
It's expensive. They say if you're not at the table, you're on the menu, right? So
I've never heard that.
Oh yeah, that's why you gotta give. I mean, it's any Congress person has got thousands and thousands of constituents, but only a couple of hundred people that are donating money, and of those couple hundred people, it's a dozen or two that are able to really influence everything. Sure. So little discouraging at times, but these are good people trying to do the best they can. This is a complicated country with complicated problems.
Yeah.
And healthcare is one of those complicated problems that they try to address.
Yeah. Well, I'm going to become more literate with your help with the whole issue of healthcare, and then I want to introduce it into my company.
Sure. Yeah.
Into our primary company.
Well, for you and for those of you listening that run businesses, we do custom healthcare literacy programs for employers using the technology they have in place and the technology we have. So if you've got an intranet where people are going to all the time, we can put together stuff specific to them, videos that will walk people through the process. Obviously, the open enrollment meetings and making ourselves available throughout that decision-making process, and really trying to meet these employees where they're at. Because we know from our standpoint, when an employee doesn't understand what they're doing, 36% of people avoid care because they don't know what they're doing. Okay. That's not good. When people don't know what they've chosen or what they're doing, that raises the noise in the HR department. And the HR department, for all you business owners, including you, Desi, there is no revenue coming out of that HR department. We're already overworked and underpaid there. And so what our goal is to help employees better understand what they bought, why they bought it, and how to use it, so that HR can do the good business of what they need to do, from all the wage and hour compliance stuff they got to do, from being the people center that they are, and not dealing with unnecessary hiccups, problems, complaints from employees on this stuff.
Yeah. If you can lower the noise level, to use your term, it absolutely makes a difference.
Yeah, it does.
Throughout the entire organization.
It is saving time and money. Any insurance broker that says, hey, I can save you money on your insurance product, that's a red flag, because they don't even know what you got. And maybe you have the right product in place, but the wrong representation. Maybe you got the right plan with Anthem or Kaiser, but you need more help you need a more invested insurance broker team that will help be the advocate when the problem happens and train your employees so they understand what they're purchasing.
So you start with something like an assessment, I assume, right?
Correct. Yeah.
Where we are.
Yeah. Tell me about, what you have currently in place. Why do you have this? How much of the premium are you paying? Is that working for you? What kind of talent are you trying to attract and retain? What companies are you competing with to get this talent? Do we need to have a really robust benefit offering in order to compete with those companies? So engineers, law firms, biotech, people competing with unions, right? Union benefits are really great. And we've got some clients that compete with those unions for projects, and we need to beef those things up. But then you have other companies that, real low margins, restaurants, stuff like that, where they want something in place because they want to help their employees, but, razor thin margins. There's not a lot of extra money there to pay for stuff. So how do we solve that problem? How do we put together something that answers employee needs while being budget friendly to the employer? And then we go from there.
I like it. Yeah. Sounds like you guys are the right people to come in and help steer these decisions, because those of us I'm good at what I do, but I don't know what you do.
Yeah.
I mention this book oftentimes on my podcast. I read a book. It's called Who, Not How,
Oh,
I think it's by Dan Sullivan. And in that book, he talks about aligning yourself with people that are good at what they do and let them
mhm.
do what they do and
I
stop
love
trying
it.
to figure out how to do stuff on your own. And even if you figure it out, the first time you do it, you're not going to do it as well as this person who does it all the time.
Correct.
You
Or
know
as
what I
fast.
mean?
Or as fast.
Or as fast, yeah.
Yeah.
Or
Yeah.
as inexpensively. It's just not a good idea. And I
Sure.
spent most of my life as a one-man show, really just doing everything, you
Sure.
know, and or trying to at least to do
Sure.
everything.
Yeah. Yeah.
And ruined my first marriage
Yeah.
because I was just never present.
Hmm.
Ruined relationships with, friends and other family members, and it just didn't it never worked out.
Yeah.
And once I read that book and I understood, okay, let me just focus on what I'm good at.
Totally. Let the
And
pros be pros in their lane, stay in your
yes,
lane. Yeah. That's
yes,
and that is absolutely who we are. We are the employee benefits side of things, very, very sharp focus on medical, dental, vision, life, disability, and,
yeah.
and workers' comp, liability. We've got fantastic partners. Refer that stuff to retirement. We don't do that either. We are laser focused on something so that we can be stone cold
I
experts.
love it. I love it. See,
Yeah.
that's what I'm talking about. You guys that are watching, some of you have your own businesses, some of you don't have your own business, but I guess you can help them, even just families too, I assume,
Sure.
right?
We work only with businesses, but I will
Yeah.
tell any of your listeners here, feel free if you're looking for expert insurance help, even if it's not something we do, if it's individual and family, if it's Medicare, if it's employer sponsored coverage in Georgia, we have contacts through our national
I love
association
it.
of fantastic people like our agency that can help you. So we're happy to help direct and get you in touch with the experts you need if it's not us.
I love it. I love it. And that's a perfect segue as we wind this down here. So, Bill, how can people reach you?
Yeah. So hammetthealth.com, Hammett health.com is our website. There's a
Mhm.
contact form there. Happy to help you there. You can find me directly at bill@hammetthealth.com. Happy to help anybody through email.
Love it.
Set up one-on-one appointments to talk through whatever is on your mind from an insurance standpoint and get you the help you need.
Hammett Health, Hammett, right?
That's right. That's right.
HammettHealth.com.
.com.
Okay, that's easy.
It's easy.
I like it. I like it. Any final comments or remarks that you might want to share with folks that are out there, Bill, whether it's business or not?
Yeah, no, I mean, I just, from the business perspective, like you said, lean on the experts. If you've got a great insurance broker, appreciate them. If you want a second look at something, we're always happy to help. We always have the same offer to any employer that comes to us. We know you have a relationship with another provider. We respect that relationship, and we would never ask you to change it unless we can do two things. Number one, prove there is a better option for you out there, a way that we can meaningfully improve your benefit offering. And number two, that we're the best ones to do it for you. If we can't do both of those things, then we will shake your hand, give you a high five, tell you to keep doing what you're doing, who you're doing it
Yeah.
with. But otherwise, it's always good for businesses to look around and make sure they got the best thing in place for them and the best representation. Because with health insurance, it's two different things. Like I said earlier, you might have the right product, but the wrong representation. So it's two different decisions.
Yeah. Yeah. I never heard anyone say that before, but I get it.
Yeah,
Yeah,
sure.
I certainly get it. Well, thank you for that, Bill. So
Yeah,
you guys, if you guys are out there, you're thinking about health insurance for your company, then of course, reach out to Bill. And he and his team will be happy to sit down with you guys and just do an assessment, see where you are and make some recommendations. And I think that you won't be disappointed. You can probably, Bill, I like to say people do business with people, not businesses, right? They do
sure.
business with people.
Absolutely.
I don't know about you guys, but I can feel that this guy is legitimate. He seems real to me. So that's why I said on air, I am going to be talking with Bill about working up something for our firm. Uh,
Great.
and I mean that. And By the way, guys, if it turns out that he's a schmuck, I'll let you know that too.
and follow-up episode, yes.
Yeah, we'll do a follow-up episode. As a matter of fact, we'll bring him back, and then we'll tell him, you're a schmuck.
Right? Okay. If you find that out, I welcome it.
Oh, well, thank you a lot, Bill. I really do appreciate you coming on here today and sharing your story with us. I find it is funny, it's fun, and this has been a very nice interview. I appreciate you today, Bill. Thank you.
Thank you, Desi. I appreciate the opportunity to come on and be a part of this.
Yes. And for you guys that are out there, thank you guys for watching today, the Freedom and Prosperity Podcast. I appreciate you guys, and I hope that you guys have found something of value here that you can use. Stay tuned for the next episode of the Freedom and Prosperity Podcast. It'll be released very, very soon. God bless you all. We'll see you all on the next episode.
Thanks for tuning in to the Freedom and Prosperity Podcast with Desi Arnaz. Want to share your success story with our audience? Head over to freedomandprosperitypodcast.com/guest and apply to be our next guest.